Okay, good morning. This is the House Appropriations Committee. It is Thursday, April 10th, 2025. It's 11:30. And we are here to talk about a bill. S-17 is an act relating to medical debt relief and excluding medical debt from credit reports. So we have Jen Carvey from Legislative Council to talk to us about the bill, and then we'll have Noel Nuff to talk about the bill.
Good morning, Jen Carvey from the Office of Legislative Counsel. We are looking at S-27. And Madam Chair, do you want the language up on the screen? Is that how he likes to do?
Sure, why don't we do that? Thank you.
Ready to go. This is S-27 as recommended by the Committee on Healthcare. This is S-27 is an act relating to medical debt relief and excluding medical debt from credit reports. Section 1 tells you why the bill is here. It is appropriating $1 million to the state treasurer from the general fund, and you'll see the source in a moment, in fiscal year 26 for the purpose of contracting with a nonprofit entity to acquire and repay certain medical debts incurred by Vermont residents as set forth in this section. So the $1 million is for the treasurer to contract with an entity, again, to acquire and repay certain medical debts. It requires the state treasurer to ensure that the entity with whom the treasurer contracts under this section will purchase the medical debt of eligible debtors from healthcare providers at fair market value, will abolish the debt with no cost or tax consequences for the debtor, will coordinate with the healthcare provider or collections agency to ensure that any adverse information resulting from the medical debt is removed from the debtor's consumer credit report following the contractor's purchase and abolition of the debt, and notify each individual whose medical debt was abolished pursuant to this section of a few things. Notify them of the amount of their medical debt that was abolished and the name of the healthcare provider or providers from whom the entity purchased the individual's debt, so which debt was abolished. The estimated percentage of the federal poverty level that corresponds to the individual's household income. And that leads into C, that financial assistance policies are available at all Vermont hospitals in accordance with the statutory provision that exists, including the following minimum discounts. And this is why it's important for people to be told what their estimated percentage of the federal poverty level is. There's a required minimum 100% discount for individuals with household income at or below 250% of the federal poverty level, and at least a 40% discount for individuals with household income between 250 and 400% of the federal poverty level. In order,
We have a question.
Maybe no, can someone refresh us what 400% of poverty level is?
when you're sitting by the
There, that's
It
fine.
is, for an individual, it's 62,600. And for a family of four, it's 128,600.
That's the federal poverty level?
That's the federal rate.
That's 400.
400%.
That's 400% annual at the annualized.
So 250 and 400%, Tom?
And does that match, those numbers seem familiar enough to match what the Affordable Care Act qualifications are?
Yes and no, and some different under expanded eligibility for premium tax credits at the moment, but yes, they are all based on percentages of poverty. All right. And then in order to be eligible for repayment of medical debt under this section, the following conditions must be met. The debtor must be a Vermont resident who either has a household income that is at or below 400% of the federal poverty level for the applicable household size, or who owes medical debt in an amount that is 5% or more of the debtor's household income, and the debtor's patient account still maintains an outstanding balance even after the healthcare provider has completed its routine efforts to collect the amounts due. So just to recap this first section then, it's $1 million to the treasurer's office to contract with an organization that is in the business of acquiring unpaid medical debt and abolishing that medical debt and I will defer to others to tell you more about what the existing organization's program looks like. But that is the concept.
Is this debt that's already been written off by the providers?
Not necessarily, I mean, I'm not sure what you mean by written off. Usually they,
Someone has suggested to me like the hospital's already written off this debt, so.
I would say this is-
Question, will we pay $1 million for a debt that's been written off?
so, written off means it's been sort of absorbed into their budgets, for future years. So whether in their own accounting systems, they have decided they're probably not going to get repaid this debt and they do get a fraction. I think it's 1% is roughly of the amount of the debt is the amount that is actually paid. So hospitals and other healthcare facilities may get made whole for 1% of the amount that they had written off. But it's still following the consumer, may still be following the consumer around or affecting their credit report.
So that $1 million goes to this firm, and they in turn, someone who's qualified, let's just say, someone owed $10,000 to UVM Medical Center. If they, I don't know what they do, but then 1% of that $10,000 would go to UVM.
Yes, I'm going to let the treasurer's office tell you more about the specifics of the program because I think they're going to do a better job of explaining how it works. But yes, it is a fractional percentage. I think the estimation and what's happened in other states is that $1 million investment can be used to abolish approximately $100 million in outstanding medical debt.
Wayne, not Wayne, sorry, Mike was first and then Wayne.
Jen, do we define resident?
No, that will likely be part of the contracting between the treasurer's office and the company. I mean, typically, we have some fairly established definitions for Vermont resident, but no, that will be part of, that is not defined in the bill.
So is my understanding now, these are nonprofits, so it's not like when you write off this debt, you could apply it for reduction of any taxes on income being made. Is that correct?
There's no tax consequences for the debtor.
No, but I mean,
For the hospital, no, I don't believe it would have tax consequences for them because they are
If you're a private business, for example, and you had a debt and it was written off, then I would assume that you'd be able to get some reduction on your taxes because of.
Are they taking it as a loss? I don't,
So they can't
I'm
take.
gonna get way out of my subject area here.
I know where you're going on that, and a for-profit is taxed differently than a
Right,
nonprofit, so
so-
nonprofits can't do it.
So it's possible there could be a for-profit ambulatory surgical center or other type of entity that is not a hospital, but yes, Vermont's hospitals are all nonprofit. And what the tax consequences look like for a for-profit, I will point to others to tell.
Sort of a CPA thing, yeah, okay, go ahead.
Okay. Section 2 is where the money comes from, and this is further amending a provision from the, I think, Budget Adjustment Act in 2022 that had appropriated $20 million to the treasurer's office to redeem general obligation bonds prior to maturity. I think this piece was getting some potential changes in the budget adjustment that has not become law, and so this remains as a $20 million appropriation reduced to $19 million.
So it's coming from the treasurer's office.
It's coming from the treasurer's office.
It was the general fund, and we've all seen the 20 million and talked about that
I
one.
figured you knew more about it than I
So
did.
just to clarify, so in the Budget Adjustment Act, I think maybe both versions, we pulled this money back. But because those haven't been enacted, the old language is still there.
So you were pulling back, as I understand, some of the money, but not all of the money. There was still a portion of it that was going to be, I think, has been earmarked or identified for this purpose.
Well, okay, but
But
the fact is so whatever that number is, that 19 million may not be accurate if either of the BAAs have
Right, this might have been referring to, right, we were sort of tracking and I was working with JFO to keep track of those numbers as the bills move through the process in case we needed to reflect a different amount that was getting reduced further by 1 million so that the money would fund this.
So if in our wisdom, we did a third BAA, we would have to adjust this again.
Yeah.
Okay.
Yes, if this bill had already, it'd be helpful if this bill was already law and then you could amend this
Yeah.
further amendment.
Thank you.
Yeah, I checked that with JFO yesterday too, because there isn't a budget adjustment. We don't have to do an amendment to this bill. And this is where we are.
All right, so then in section 3, we're pivoting a little bit from, we're no longer looking at specifically this, this interaction between the treasurer's office and a nonprofit entity. We're looking more at just credit reporting of medical debt generally. This would add a new provision, section 3 would, in the Consumer Protection Act in Title 9 that would prohibit reporting of medical debt information. And this would prohibit a credit reporting agency from reporting or maintaining in the file on a consumer information relating to a medical debt. And then it defines healthcare services, and healthcare services are defined because they feed into this definition of medical debt. Medical debt means debt arising from healthcare services or from, including dental services, or from healthcare goods, including products, devices, durable medical equipment, and prescription drugs. And then it clarifies that medical debt does not include debt arising from services provided by a veterinarian, debt charged to a credit card, unless the credit card is issued under an open-end or closed-end credit plan offered solely for the payment of healthcare services. Somebody had a special healthcare credit card. It also does not include debt charged to a home equity or general purpose line of credit or secured debt. So again, having a ban on credit reporting agencies reporting or maintaining in the file on a consumer information relating to a medical debt. Sections 4 and 5 kind of operationalize some of what it would look like for the nonprofit entity to be figuring out which patients have medical debt and are eligible, may be financially eligible for the repayment. So section 4 is amending a provision of Vermont law, also in the Consumer Protection Act, that requires disclosures to consumers anytime a credit reporting agency is going to pull their credit, or anytime somebody's going to pull their credit. In general, nobody can access your credit report without your permission. That's stated more affirmatively in a different part of this subchapter, but this is the disclosure piece, except under the following limited circumstances. So general rule is nobody can access your credit card without your permission. There are some existing exceptions. This adds a new exception where the request for a credit report is by an organization that is exempt from taxation under section 501c3 of the IRS code for the purpose of determining eligibility for the abolition of medical debt. And then we have the same thing in section 5 more affirmatively here, that the provisions of section 2480E, which is the one that says nobody can access your credit report without your consent, shall not apply to an organization that is exempt from taxation under section 501c3 of the IRS code when determining eligibility for the abolition of medical debt, provided, however, that the exemption from the provisions of section 2480 shall not apply to a tax-exempt organization that is a large healthcare facility as defined in statute. So the idea here is to, this is language that the House Healthcare Committee added that provided, however, piece. There was some concern that hospitals could use this, hospitals that are exempt from taxation could try to use this as an end run around having to get consumer permission before pulling a credit report. So this is saying the whole idea of the abolition of medical debt and pulling of consumer credit information by a nonprofit organization is really for the purpose we were looking at in section 1 of the bill, and not for hospitals to start poking around in people's credit reports.
I'm a little confused on the credit reporting portion. If an individual has $10,000 today in medical debt, my assumption is that can be reported on their credit report. Is that correct?
Under my understanding is under current law, yes. Federal regulation came very close to saying no, but I think those consumer protection Bureau rules or regulations are on hold.
So, let's just say the $10,000 is on an individual that only is between the 250 and 400% of federal poverty. So only 40% of that, I assume, is applicable to the bill.
It really depends what the person, so that a couple of things, these limitations, or these financial assistance policy minimum requirements have only been in place for a few years. So somebody may have older medical debt. People may not always know or be informed about or take advantage of a financial assistance policy. So they could still have incurred $10,000 worth of medical debt, even though had they known about it and applied for it, they may have been eligible for a lesser amount.
So all 10,000 doesn't get reported anymore?
So if it is
Just the 4,000 that there would have been.
So the only purpose of the language in here about the financial assistance policies is just to make consumers aware in the future, if they're income eligible, they may be able to use a financial assistance policy to avoid incurring future medical debt. So that's the only reason that this financial assistance piece is in here. So if somebody has accrued $10,000 in medical debt, that doesn't go anywhere until you do something in this bill. So there could be the abolition of the medical debt using the contract through the treasurer's office. And then part of that process is to work to get the item off the credit report. This is sort of going forward. Credit reporting agencies cannot report or maintain information about a medical debt.
At all.
Right.
You may be the wrong person to ask, Jen, but we had a Rutland Region meeting the other day with the Community Health Center, and they're talking about their finances and whatnot. And they gave us a number of what they write off each year in debt, okay? But they were clear to point out there's two kinds of debt. There's the debt of people who just have no ability to pay, and they obviously willingly take that off. That's just part of what they do. And then there's a portion that is people who maybe have the ability to pay, but choose not to pay.
So this is
Could
charity
be-
care versus bad debt.
Right,
Yes, those are the two
And
categories
so
of compensated care.
My concern here is if they can no longer report that that gets reported to the credit agency, what's the incentive for someone who has, large copays or something that just doesn't feel like they want to pay because now there's no consequences? Because it's never going to go on their credit report. I'm not talking about the person who legitimately has bad debt. I'm talking about the person who's like, pay my insurance premium, I'm not paying any co-pays.
I don't think I have a good answer for that.
Somebody else might, and I've got lots of people listening.
Yes, okay.
So hold that thought and we'll
Yeah.
see if somebody else can answer that question. Tom?
And so my understanding of other schemes to pay down medical debt, probably devoid of the details that are here, but my understanding at one point was that the hospital may give up on a debt, or they may sell a debt to, or offer the debt to a market. And I'm thinking, of course, I can also apply this to student loans and a whole bunch of different debt, where they actually offload the debt or offer for other people to come in and buy it at a reduced rate, and then that company is allowed to then go after that debt.
Well, you stopped allowing that a few years ago in the same
For medical debt
for
or?
medical debt, in the
Okay.
same bill that created the minimum requirements for patient assistance policies.
Thanks.
So we're about to look at an amendment to that. It's a very timely question. So section 6 is amending that existing subchapter in Title 18 in chapter 221. Subchapter 10 is patient financial assistance. That's where those policies are. And we would add and medical debt. And this would add to an existing prohibition on the sale of medical debt, also prohibition on reporting. So first we have new subdivision A1. or adding on to existing subsection A and making it subdivision A1, no large healthcare facility, which is defined as a hospital, an outpatient clinic affiliated with a hospital, and an ambulatory surgical center. So under existing law, they are not allowed to sell their medical debt. This would add except as provided in subdivision 2, so that section 1 of the bill works. So this allows a large healthcare facility to sell or otherwise transfer its medical debt to a tax exempt organization for the specific purpose of that tax exempt organization abolishing the medical debt of one or more patients by cancellation of the indebtedness. And then it also specifies that those facilities, no large healthcare facility or medical debt collector shall report or otherwise furnish any portion of a medical debt to a credit reporting agency. The medical debt collector is not actually buying it, they're working on behalf of the large healthcare facility, but I believe they don't own the debt. So that's why we're still referring to medical debt collectors. And the effective date, act would take effect on July 1st.
Stick around, please.
Hey.
Thank you, Jen. And Nolan, do you want to come and talk about the fiscal route, which I think we also have on our committee page?
All right. For the record, Nolan Langwell, Third Fiscal Office. I will be very brief because I feel that A, Jen has already covered everything. And B, I don't want to steal the treasurer's win. So,
Okay,
so section 1 would appropriate 1 million from the general fund to the treasurer's office to contract with a nonprofit entity to acquire and repay certain medical loans incurred by Vermont residents. Jen talked about that. And then section 2 is where the amendment happens to the previous appropriations. So it's further amends Appropriation Act 83 of 2022 as amended by Act 185 of 2022 and Act 78 of 2023. And for the fiscal years 2023 and 2024 appropriation acts respectively. And as you know, it reduces the appropriation from 20 million to 19 million. Bring up the 1 million to be appropriated. And as for how that money will be spent, again, I will let the treasurer talk more specifically about that program.
any questions for Nolan? All stuff we've heard before. Nolan can stick around. I'm sure Jim will come up with
It's a pretty
something.
lengthy fiscal note. It's going to take me time to.
You know, after our 14-page one earlier this week, we're kind of happy with that.
Good easy. All right. Each one for
So P-check or somebody from your office or would Representative Page, do you want to say anything about this?
Sure.
Why don't you come sit at the edge of the table? Thank you. And introduce yourself to us, please.
Yes, I'm Representative Page, as many of you know. It's a little different being on this side of the table compared to last term.
Yeah, this end of the table.
Yes, I could.
You'd rather deal with the sustainable healthcare system.
Thanks, Tom, for that.
It's nice to have you back in our city, Representative.
Yes.
It's very nice. Thank you. I'll only briefly just describe a little bit of the bill and tell you something that we talked about and what the treasurer and the healthcare advocate have discussed. Medical debt can happen to any of us. And I think we probably think of medical debt as a catastrophic incident where, you know, you have a heart attack and you end up in the hospital with huge debt. And that does happen. And it can, you know, bankrupt a family. It can bring a lot of distress to a family that may or may not seek medical attention after their, you know, medical situation has been resolved, because they don't want to add more debt to their family's situation. I will also mention that in our committee today, we just had a group of women regarding fertility issues. And it was not something that I thought about until the individuals were talking about their experiences, the wait times, the expenses in going through treatment to become pregnant. And so this is another form of medical debt that I had never even thought of. Again, it occurs to all of us, and I think this is a very good bill. I think it will help out a number of Vermonters. And the vote was 11-0-0. So it has the committee's support. And with that, without further ado, I will pass the baton to the
I'm going to just
treasurer.
see if anybody has any questions for Representative Page, Jim.
Oh, I'm sure you have something.
Thank you very much.
Thank you,
If you want to stick around in case something
Sure.
comes up, we'd appreciate it. And I'm thinking it might be Treasurer Pichek who wants to come up. I'm not sure if you have a phone a friend or if we'd like, yes. Thank you. And I've been through some of this before. I can't remember, but certainly the highlights would be helpful. And you heard some of the questions.
Yeah, for sure. Absolutely. Well, thank you very much for the committee. Thank you for having me. Today I'm joined by Ashlyn Doyon, our Director of Policy, and Becky Wasserman, our Director of Financial Empowerment in the Treasurer's Office. Becky would be in charge of working on this program if it were to pass, getting a contract in place with undue medical debt. And then happy to talk about how that relationship administrative process would work, which is part of this presentation, which I know is some of the questions that we heard as well. But, you know, I think we can skip maybe a couple of slides because we heard about the impact of medical debt, number one cause of personal bankruptcy. Many Vermonters don't have monies to buffer the shock of a medical bill, not just because they may be uninsured, but the growing amount of people who are underinsured as well with large deductibles and large copays. So this bottom part is important because when you think about the benefit of this program, there's a financial element to it. Even though the economic value of the debt has been diminished down to the point where you could buy it for a penny on the dollar, that face value is still hung around the Vermonter's neck. So they are feeling the full impact of the $10,000 that they owe, whether it's showing up on their credit report potentially, whether it's preventing their access to credit because it's being asked for by a bank or a credit union when they are applying for a loan, whether it is being factored into their credit score, so they're paying more in interest when they do get a loan for a car or a home or a credit card. All of those financial impacts are definitely real, but there's also the delayed healthcare impact as well. So there's a financial benefit and then a health benefit. And even when collection attempts have stopped, patients remember and are more fearful of going and getting healthcare because of the shame that they have of holding medical debt, the fear that their provider won't see them because they owe them medical debt, or just quite frankly, they're worried about accumulating even more medical debt. And when somebody doesn't get the healthcare they need when they need it, it's a worse health outcome, but it's also more costly to treat as well, which also has obviously a financial impact to them as a person, but to the system as a whole. So if we skip ahead to the next slide. Again, this is a pervasive issue. This is a statistic for the United States, but the estimated number of people that would be impacted by this proposal is about 60,000, 60 to 65,000 is the estimate. So a significant number of Vermonters, have medical debt. On to the next slide is a little bit of a history of undue medical debt. So this is the national nonprofit that has been working in this space for now over a decade. And I have this slide up here just to show their expertise in this area. It was founded in 2014 by former debt collection executives. It's really the leading organization, charitable organization to help pay medical bills. They just announced a huge settlement, negotiated settlement with a large purchaser of health debt for I believe it was $30 billion of medical debt. So this number that we have here, where they've relieved 15 billion over the last 10 years, they've now more than doubled that number, impacting 10 million Vermonters across the impacting 10 million residents of the United States. So they have a deep expertise in this. They have been doing it for over a decade. It's a philanthropic organization that has been mostly funded by donations. They had a significant one from Mackenzie Scott. But then you'll see on the next slide that they have started, well, I'll just say they have started to have relationships with states. But on this slide, I think this is an important one to highlight because through their philanthropic efforts, they have impacted Vermonters to date. There are some testimonials that we received from undue medical debt. This is one on the left, individual named Bobby from Richford, who talks about receiving the letter in the mail about her medical bill being abolished through the generosity provided by Principal Financial Foundation. So that was the entity that had donated the money to work with undue medical debt. This would have been the state of Vermont in connection with undue medical debt if this was under this program. She describes being shocked by the notice. She describes how it touched her heart. It's truly been a blessing trying to figure out how she was going to pay for her outstanding medical bills, and that everyone who donates to this program is an angel in disguise.
Jim.
So this happens in Vermont today for this organization?
The organization has no, on their philanthropic side, has no geographic limitation. So there are some Vermonters, I think it's a very small number, that got the benefit of their philanthropic activity. So that's sort of where the idea came from for the first county that wanted to enter into a direct partnership with undue medical debt, was they wanted to direct the benefit to their geographic area rather than it being spread out through the country.
So people in Vermont today then can apply or receive help from this nonprofit.
Yes, there's no application process. It all happens through negotiation. So the reason I say a very small number of Vermonters would have been impacted previously or have the possibility of being impacted without this bill is because a lot of our large providers can't sell their medical debt. They're not, that's, Principal Financial Foundation. They donated to Undue probably to buy somebody that was holding medical debt for a financial reason, a national financial carrier. So that certainly some Vermonters, but a very limited number would be eligible for that kind of philanthropic relief.
So in the proposal in the bill, it would be more working specifically with the hospitals as opposed to
Vermont providers.
Party out of state thing that was.
Yeah, exactly right. That big settlement that I mentioned was with a national financial institution that holds medical debt nationally. Again, probably very limited number of Vermonters are in that pool.
So to be clear, these companies now, this company or these organizations would contact the large medical facilities. You'd weed out based on the boundaries here, the income boundaries. And essentially, again, my understanding from reading about this in other states is that you don't make an application that the company's getting a list of people who owe money. And so Bobby's surprised because they had no idea that this organization was going through this process. Is that right?
Right. Bobby or Emily or anybody else in Vermont, but first they would have heard of it unless they were following it in the news or in the legislature, would be when they got a note from Undue Medical Debt in our office that told them their debt with XYZ provider has been forgiven. And here's the notification of it.
And just a clarification, are we still the only country that basically has such a deep medical debt issue?
I think we're one of the top countries with the medical debt issue for sure. If you think about this bill and the way we've talked about it, it's an important step in providing some help to Vermonters, making it more affordable, helping with healthcare affordability. But there's obviously a lot of gaps in the healthcare system that get people into this place to begin with. Plus, on top of those gaps that exist, our healthcare in Vermont's the most expensive in the country, and we don't have the highest wages in the country. So that gap between what an average person pays for healthcare in Vermont is large relative to other states.
And this $1 million is expected to cover up to $100 million worth of medical debt?
Yeah, exactly right.
Well, I'm gonna pause, I'll get you in a minute, but I have to go to a meeting at 12:15 and I would like to get this voted out before I have to go to the meeting at 12:15. So I'm just sort of giving everybody a timeline.
So I'll go quickly.
10 minutes. Jim.
Oh.
I kind of feel that comment was directed to me.
I thought it was directed to me, so.
How long will that $1 million last? Is this a one and done, or is this going to be an annual $1 million that you're looking for to buy down, that amount of debt?
Yeah, so I think it's important that it is set up as a one-time program. It's a one-time elimination of medical debt. How long it will take to do the negotiations? I mean, it could be a year to sort of get to the point where we feel like we've gotten to everyone that wants to participate in negotiation. But the reason I say it's important that it's one time is, if it's an ongoing action, you could start to talk about, will it change behavior for people in terms of their likelihood of paying their medical bills and the like. Because we're looking at older medical debt and it's a one-time elimination, we don't have to have that conversation. And that's the intent, is for it to be a one-time retrospective elimination. And then the protection of the credit score is what is thought of as looking prospectively into the future.
You heard my question earlier about concern about credit score reporting for people who just don't want to pay. It's not the people who can't pay, that they just don't want to pay their co-pays or what have you. Has anybody looked at what the outcome of that's going to be?
Well, I'll just mention this other testimonial because I think it's helpful. This is somebody from Vermont who says, they're excited their medical debt's been abolished. They racked up the debt when they had a mental health crisis. They were put into an ambulance. So I think that part of it's important. Usually medical debt is something that is happening to you. It's not an affirmative decision to go out and get credit, to make a car purchase, to buy a house. But then they talk about how they weren't properly charged by their insurance company. They racked up $9,000 bill. They were too sick to even deal with it. So I think that's an important part of this concept as well, is not only are you not making a decision to have the medical emergency, but you're dealing with the medical emergency when you may be in a battle with your insurance company. So this person says she ended up refusing to pay it because it was their mistake. Almost couldn't buy a house because of collections, having my debt abolished.
Between the consumer and the insurance company.
Yeah.
Lastly, Mr. White Chair is going to hit me. How many states have set up this type of program?
Good question.
Yeah. So if you go to the next slide, you'll see in terms of states, Connecticut, Rhode Island, and the Rhode Island treasurer has been up testifying in the State House about their program. New Jersey, Arizona, the District of Columbia, Pennsylvania, and Illinois. So those are the ones that have an active program. And then there are some large cities and some large counties that have also done the same: New Orleans, Pittsburgh, Toledo, Ohio, Cook County, Illinois. So in total, there are about 20 jurisdictions, but there are about 7 or 8 states.
Any of them had it in place? Maybe it's in here for a while.
So the one that would have been the earliest is Cook County, Illinois. They came up with this concept during the pandemic. So that would have been in 2021 time period.
Okay.
And then on the next slide, I think we can answer some of the questions about, I think both Representative Harrison's point about, what's the impact to the hospital. We asked medical debt in our due diligence, hey, we have nonprofit hospitals in Vermont. We have great patient assistance programs. Is this a good fit for Vermont? And they said, yes, this is our typical provider that we work with. It's a nonprofit provider. They have never sold medical debt. Even if there's no prohibition to selling medical debt, they don't do it. They don't sue or report their credit. So a lot of the large Vermont hospitals don't report credit to begin with. That's not to say that's a universal thing. There are others that do, and maybe for-profits that do. So providing that prohibition provides sort of protection to people that are on the outskirts or fringes, if you will, in terms of getting access to healthcare, racking up a medical debt, having their credit score impacted. And similarly, that each of these hospitals provide solid financial assistance. So really, Vermont is a perfect candidate to work with undue medical debt in that way. And then to talk about the process on the next page, you'll see that, it's really voluntary. The providers have to want to participate. Part of our job will be making sure we interact with the providers. We have done that prospectively, but if the bill passes and is signed into law, that will work with them and undo medical debt to make sure there's a connection there and that the negotiation happens. Once they decide they want to participate, they'll enter into a non-disclosure agreement, a business agreement, protecting the confidentiality of the information. The hospital will turn over their debt files to Undo for their analysis. Undo will then go through, apply those eligibility criteria, determine who's eligible and whose debt they want to purchase. And then they will go to the hospital with an offer. Some hospitals have donated. They have not accepted the penny on the dollar. Some have donated the amount of money. We hope some in Vermont will consider that. Other hospitals have dedicated those funds to patient assistance programs. So they're specifically helping patients. But regardless, there's a negotiation, a price is agreed on. And then once that's agreed on, a hospital can decide to make their participation public or not. Some may want to keep it confidential. But either way, the patient is notified that the debt has been forgiven. And that is undue medical debt that will handle that notification process in terms of the administrative costs. And in terms of where the money works, the $1 million will stay in our office. Once undue medical debt has reached a negotiation with a provider for a set sum of money, let's say it's $100,000, they'll then invoice our office for that amount of the money. And they do get a 10% administrative fee for their work in the negotiation and then into the notice in terms of the Vermonters. That's how they are able to sustain their organization. But our office ultimately holds the money and approves the invoices for payment. So another important point there, if we just stay on that last slide for 1 second, I think folks maybe on the committee understand this, but the debt that we're focused on is older medical debt, 18 months to 7 years old, measured at the time that the date of the service was provided. So it's been through the billing and collections process and hasn't been paid on. That's why the economic value is so low, even though the face value is so high. And then, of course, I made this point already, but even though the collections activities have stopped, medical debt remains outstanding and continue to have negative economic and health benefits on the residents. And then for those that might be focused on the provider side, because of the way the program's set up, it can only have a beneficial impact on the providers. They could decide to donate it. They could decide to, earmark it for something specific, but it won't have a negative impact on the hospitals or the providers.
I'm going to have you pause there. I know we've had 2 members talk to their hospitals. John, do you want to say anything about that?
Sure. I had a brief conversation with our CEO about something completely different, but this came up here based on she had shared with me earlier. And they're very in favor of this here. It helps them move things along here because it does kind of cost them something here, the longer they're holding on to this. And it is a significant burden here for a lot of folks that maybe can start paying part of it, but they just can't make up balance, it's just too great, or they can't even begin. So it's a very positive thing for our hospital.
Great. And Mike, you also?
Yes, same, our CEO, Southwest Medical Center, also described it as a win-win, definitely kind of expressed the concern about folks with medical debt being unwilling to seek treatment.
Yeah.
Which those sort of delays create more expensive treatment down the road.
Okay, great. Jim, you can have the last word.
Yeah, I go back to.
I'm asking, I'd like to speak as well.
Oh, Jim, after Jim, Lynn, we'll get you. Yeah.
Okay, thanks.
I was unclear about what federal law prohibits versus state law in terms of credit report. It almost sounded like federal law already prevented reporting of bad medical debt. And I'm just trying to understand that.
So the CFPB, the Consumer Financial Protection Bureau, they've been looking at this issue of medical debt for some time. They issued a rule that's very similar to our law that prohibited the reporting of medical debt.
Yeah.
But the rule was implemented toward the tail end of the previous administration. There is the rule. I don't think the rule's even in force at this point. The rule's being, the whole agency is being attacked in terms of its potential existence. The rule is being attacked in terms of its specific existence. And then I think there's also some challenges otherwise to the bill. So some states like Rhode Island, like we're proposing here in Vermont, we wanted to, when we proposed this, it was really to be belt and suspenders, but now it's pretty clear the federal rule is not going to exist. So it's really a primary protection.
All right. Lynn, quickly, and then we need to vote.
Okay, I just want to say that I also got a call from my local hospital administrator. There seems to be a lobbying effort here. And I expressed some of my concerns to him, and he and I talked about this situation. And similar to the kinds of things that Jim Harrison brought up about people who can't afford to pay, are never going to be able to pay, who really just are in a situation versus people who choose not to pay for a variety of reasons. I have my own little testimonial from when I sold real estate probably about 30 years ago, 20 to 30 years ago. And we had a young couple that came from Burlington to look at a house in Ennis. They were looking for a house in Franklin County because that's all they could afford. He had been in the military. They had lived in an apartment complex in the Midwest somewhere near his base, wherever it was. A couple of years had passed. They had now saved up their money. One of them worked for the recreation department in Burlington and the other one had a job somewhere else. Anyway, they didn't have a lot of money. They were living with her parents. They had no credit cards. They paid cash for everything. They had a secondhand truck. That was their only vehicle. I tried to find a way to go and get a credit history for these people. They had no credit history. The rental units out in the Midwest, some big, large complex, they'd had no record, it was too far back and they didn't have any real records. The only way these people were able to qualify for a VHFA mortgage for this very small house in Innisburg was because she had had a medical operation at the Fletcher Allen or whatever it was called then. And they had a payment plan and they paid it in a year. That was the only credit history they had. And
So
they were
Lynn, I'm
able to
gonna
buy a
pause
house.
for a second. Lynn, I'm gonna pause you for a second. I have to go to this meeting. I just talked to Rep Harrison. We're gonna vote on this at 1 before we go to the floor. So
But
you
that's
can
what I
keep
just
going. Jim will
wanna
run
say.
the meeting and then we'll vote at 1 o'clock. Thank you.
Thank you. Yeah.
You can
it just
continue
was-
your story.
Now, I don't know how many Vermonters there are that are left like that, who will honor their debt and pay it up and do whatever they need to do. But that was the only way they could purchase a house. And that immediately was a credit history. So,
I can't speak to every scenario in Vermont, but just to, what exists now from Fletcher Allen with the UVM Health Network, they do not report to credit score, to credit rating agencies. So that same scenario, that this wouldn't have, that even regardless of anything we do, it would not show up on their credit report today.
that's true. That's true. But the issue is that payment plan that they set up helped these people. That was enough of a credit history to give them a loan through VHFA through a bank.
Right. I think just in the totality of circumstances, it's going to be vastly overweighed by the people that are in debt and being financially impacted by the debt being reported in terms of higher interest rates or potentially limited access to credit than somebody that's their only source of credit history. In the totality of circumstances, I think the scenario that I described will be the vast majority, and people that is their only or maybe primary way that they develop credit will be in the vast minority. Not to say it doesn't happen.
Okay, thank you.
As Robin just mentioned, we will convene at 1 o'clock for purposes of taking a vote on this bill. So in the meantime, we'll break for lunch. And at 1 for just hopefully a short